Addicted Northcoast is sponsored by Sutter Coast Hospital in Crescent City.
One of the major problems with the early part of the opioid epidemic, if you will, was the fact that the pharmaceutical industry saw this as a huge potential money-making proposition.
Hello, and thank you for being here for our special roundtable, Addicted Northcoast. I'm Nazi Javid. The addiction crisis affecting huge chunks of our nation, killing people, destroying cities, and impacting crime rates. Today, I'm joined by a group of panelists to discuss addiction issues right here in our Humboldt and Delmort communities. With me now is Dr. James Willis. He is a pain management physician at Sutter Coast Hospital in Crescent City. We have Officer Ryan Swanson with the Eureka Police Department's Mobile Intervention and Services Team, or MIST as it's referred to. Also with us is Raina West, Substance Use Disorder Administrator with the Department of Health and Human Services Mental Health Branch. And finally, someone who has suffered with addiction herself and managed to miraculously turn her life around is Fortuna resident Rebecca Cunha, an addict in recovery. Thank you all for joining me. It means so much that you came and took time out of your day to spend this time with us and participate in this discussion. We are also having live on Facebook. So our own Lisa Librignac is monitoring your comments at home, and we will take some of your questions live as the discussion progresses. We want everybody to take part and have a chance to share insights on the issues and then, of course, solutions. So, Dr. Willis, we're going to start with you, sir. You actually are a pain management physician. You do great work in Crescent City at Sutter Coast Hospital. In fact, our own Lisa Librignac drove up to see the kind of work that you do. She met with you. Can you just give us a brief description of what it is that you do?
Well, basically, I'm an interventional pain management physician, which means that I offer people alternatives to opiates. And the alternatives that we're talking about are injection procedures we use to destroy nerves that transmit pain, and also things like spinal cord stimulation, which allows us to take people who have been in severe pain for a long period of time and turn it around. That's basically what I do. I've been doing it for 30 plus years.
Fantastic, and we actually want to show folks what it is that you do. So we met with you, Lisa did a story. Let's go ahead and run that story for our viewers.
The original concept of treating these people is to treat the whole person.
Dr. James Willis is a pain management specialist at Sutter Health in Crescent City.
Addiction is more of a behavioral issue. In other words, how are you going to continue maintaining your supply of medication or whatever you're using?
He works with people suffering from chronic pain, specializing in alternative treatments.
There was something that was very popular a few years ago called a multidisciplinary pain clinic. And in that clinic, you would have psychologists, you would have pharmacologists, physical therapists, people like myself who do interventions.
Willis says a multidisciplinary clinic is still considered the gold standard of treatment.
They would be given education about their pain. They would be given the appropriate physical therapy. The psychologists would look into their problems, treat their depression, and almost all chronic pain patients have it.
He says it's the ideal way to manage chronic pain.
Unfortunately, most insurance plans absolutely will not pay for it. They do not wish to pay that kind of money for treatment of chronic pain. And oddly enough, they do wind up spending a lot of money over the years with surgeries, with expensive drugs, and multiple doctor visits. So it's sort of a short-sighted approach to it. But there aren't really many of the multidisciplinary clinics around anymore just because of the economics.
But Willis says pain management physicians are extremely restricted when it comes to prescribing opioids. Regulations have added administrative headaches, leading to a climate of fear for doctors, and leave patients unable to get medications when they really need them.
With the medical board looking over their shoulder and the DEA, the FDA, and the Center for Disease Control giving them arbitrary limits as to how much they could prescribe. And in many cases, it's a fairly low limit, and it tended to slide down further as the various regulatory agencies thought about it. What happened is that the physicians were really being forced to reduce the amount of opiates that the patients were taking.
And when the opioid supply is reduced, some struggle to put up with their pain, and for most, serious suffering almost always follows.
And in some cases, people could do that. In other cases, they couldn't and wound up committing suicide. A very unfortunate situation.
It's very impactful and very frightening to think of those strong words that you said there toward the end. You had mentioned, you spoke with Lisa, and we wanted to talk to you about, is there a point where doctors are just flat out refusing to write prescriptions for pain medications, and why?
Well, it's pretty straightforward. It's a bit of a complex story, but it's what happens when you have unintended consequences. About 15 or 20 years ago, people were not treating pain adequately. There were people who were suffering, and that came to the attention of the legal community and also the legislative people in California. And what they wound up doing was saying, okay, you guys, you need to prescribe, you need to be more aggressive at treating chronic pain, and we're going to say that it's almost malpractice not to do so. And so what happened is the number of physicians that were not prescribing started prescribing, and then that snowballed. We also had the pharmaceutical industry coming in and asking people to use their new drugs and promoting them. And then what happened is people started having access to a fair number of opiates, and what would happen then is if the drugs would essentially get not necessarily intentionally diverted, but they would get into the wrong hands. And we started seeing deaths as a result of that. The typical one was the teenager who would go into her mother's medicine cabinet, take a big bottle of OxyContin out, take it to a party and distribute them to her friends, some of whom that would then die of an overdose because they had never seen that opiate before. So that started the pendulum swinging back in the other direction. And what happened is the regulatory agencies, and particularly the law enforcement agencies, including the medical board, started telling physicians you can't do this anymore. And they used severe sanctions. In many cases, actually taking the physicians to an administrative court hearing and taking their licenses away. And I know a fair number of excellent family practice docs who were liberal prescribers, but they were doing it the right way, who wound up losing their license and being severely sanctioned. So as a result of that, almost all the family practice docs now are running the other direction when someone comes in and asks for opiates.
So there's the climate of fear, essentially.
Yeah.
What did you mean in that story when you said it's a behavioral issue?
Well, there's two parts to opiates. One is physical dependence. And anybody who takes opiates for any period of time will develop a physical dependence to the drug. And then if it's taken away abruptly, they'll undergo withdrawal symptoms. Addiction is a little bit different, at least from my perspective. In the first group of patients, they're trying to treat their chronic pain. In the addiction situation, they're looking for the euphoria, the high that comes with it, and addicts will tend to do whatever is necessary to get their drugs. So, yes, everybody that takes opiates gets physical dependence. They will all withdraw if the opiates are taken away. But again, the behavioral portion of it that kind of defines addiction from my perspective. Other people may not agree, but that's sort of how I see it.
All right, we need to take a break, but we'll be right back with Addicted Northcoast.
Addicted Northcoast is sponsored by Sutter Coast Hospital in Crescent City.
We're going to move to MIST Officer Swanson with the Eureka Police Department. First, can you tell us what MIST is?
MIST is the Mobile Intervention Services Team. It's comprised of myself. I work hand in hand with the Department of Health and Human Services. I have clinicians, or mental health clinicians, mental health peer coaches, and we basically go out and try and help people that are, some of them are out on the streets. Most of them are actually out on the streets, and they can be suffering from addiction issues, from mental health issues. A lot of the time they're suffering from both. And we try and get them connected to the services so that they can, basically start rebuilding their lives.
What's your advice to other police officers? How do you build that rapport when you're trying to balance, enforcing the law, but also being compassionate?
Every situation is different. Sometimes when we get on scene, we have to take the enforcement action right away, depending upon the situation. But even if you do have, you do arrest somebody, you take them to jail, you have that time in your patrol vehicle to talk to them, trying to get them, to see that there are other options, services out there. And again, very few people that I talk to on the very first time I meet them, they're like, yeah, I want to go to recovery, I want to go to rehab. Most of it is prolonged contact, building rapport over time, and letting them know that basically you truly care about trying to help them out.
Let's go to Ms. West now. You are with the Department of Health and Human Services Mental Health Branch. First, tell us a little bit about what you do, the work you do.
Well, I manage some programs through the Department of Health and Human Services, mental health. Some of them bill drug Medi-Cal, which is the insurance portion of people who have Medi-Cal or partnership health care here in the county. So I have some drug Medi-Cal billing programs and also some programs that are grant funded. One of them supports MIST and Dr. Swanson's work. Officer. And also, so the outpatient programs that we support, we've got one that's pretty much open to anyone who has identified substance use disorder or is interested in getting some treatment for that. We have intensive outpatient and outpatient treatment groups for people wanting to explore recovery. We also have an outpatient program for moms who have children under 5. That includes child care as well as parenting classes and some mental health that's integrated with mental health clinicians to work on other things like trauma or mental health issues that parents might have. And then we also support some rural programs. We've got substance use disorder counselors that work in regional services to help people in some of the outlying areas. And we also have some substance use disorder counselors in the jail and some of the Community Corrections Resource Center. So DHHS has a lot of support throughout the area in substance use disorder treatment.
It's phenomenal. My question would be, if I'm an addict and I need some help, or if I'm a relative of an addict who needs help, how do I tap into those resources? Where do I go?
Let's see. Well, so for our outpatient services, we have intake 4 different times a week. So you'd be able to call our office and find out when those are. Or I can tell you it's Mondays at 2, Wednesdays 9 to 2, and Fridays at 9. And that's over at our main office at 720 Wood Street in Eureka. That would be to access outpatient services. It's kind of a great place to start because in those intake sessions, you'd meet with a substance abuse counselor who, if that level of care might not be appropriate, so someone might come in not really knowing where to start, and they might say, I need help, but not really knowing what they need. And sometimes residential treatment might be an appropriate level of care, or they might be in a place where they can just attend a few groups a week and have some outside support as well. So we do have counselors that'll help guide them to the right place.
And when we're talking about addiction on the North Coast, just from your perspective, and I know I didn't ask you to bring the numbers or anything, but just from your perspective, the folks that you see come in for help, for treatment, are they more often than not opioid related, meth related, alcohol related? What do you see the most?
I think it's Probably a combination of those three. So probably meth and opiates are equal, maybe meth a little bit higher in this community, but also alcohol. Alcohol is probably the #1 substance that people are seeking treatment for still.
How does the county and the state define addiction?
Well, the American Society of Addiction Medicine came out with a new kind of definition, and I believe that was last month, and I have a copy of it.
Yeah, I would
if you'd
love
like
for you
me.
to read it to us. Thank you.
Okay, great. Yeah, I read this last week, so I think it's pretty neat. So the updated definition reads, addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. Prevention efforts and treatment approaches for addiction are generally as successful as those for other chronic diseases.
Dr. Willis, where do you agree with that or disagree with that?
I think that's an excellent definition.
And we have a woman here with us, Rebecca Cunha, who has suffered with addiction herself. What's your definition of addiction?
Miserable.
Misery.
I honestly don't know the definition for it. I just know that it's just, it's something that you can't control immediately. It takes a lot of time.
You came from a really dark place. I want to tell your story a little bit. I know it's a difficult one to tell. You really have miraculously changed your life around, though, no doubt. I mean, I think that word defines your life today. I actually contacted the Humboldt County Sheriff's Office. If we have a mugshot here of Rebecca in her past life, what do you see when you look at that?
I mean, it's embarrassing to me to look at now, but I totally see somebody that's sad, that's, I don't know, empty, broken.
How'd you get there?
I got there by a choice that I made. And sometimes we learn from bad choices, but that was a choice that I made that I'll never make again. And I don't know, I just picked up one day and it just went through my life.
I want to show the photos of Rebecca today and her family because she's certainly really turned her life around. You and your husband were involved in a life of crime before this, and this is your family today now, right? You have several children, you're healthy, you're both contributing members of society and involved in the community. And if you look at this picture and you just see the transition, I think what everyone watching this is going to say is, how did you do it?
How did I do it? You know what? There comes a point in somebody's life where they're just done. You know, I lost all my kids to the system, and I still was out there using drugs. I wanted to stop so bad. I mean, there was nothing that I didn't want anything more than to stop using, but it was a struggle just to keep going out there and getting high one more time. I just want to get high one more time, you know, and my kids were gone and I was miserable. I was sad. I was broken. I was empty. I was just done. I was fed up. And it just took a little bit of help. I guess you would say a little bit of help. The very last time I got arrested, I knew that I was going to use that to my advantage. And I knew that that was the last time that I was ever going to use. And I didn't use again since then.
Where did you go when you made that decision? What was your first step?
I went to jail, but...
and when you came out, how did you...
I went to a program. I put myself into a program. My kids were in the system, of course, and, you know, I didn't really have much help from social services. There was a couple social workers that were really awesome, and I really loved them, but then there was a couple that weren't so awesome. And I don't know, that wasn't mandatory. She didn't make me go to a program, but I put myself into a program because I knew that if I got out on the street, even though I hadn't used the whole time I was in jail, I knew that I wasn't strong enough. I just knew I wasn't strong enough. So I was literally on the street for a couple days. There was a couple days where I was out, you know, not literally on the street, but I was staying with at somebody's house. And that couple days was, it was challenging. It was very challenging. And so I went, as soon as they had an opening into a program, I put myself in there, and then that was it. I never went back to that old life.
You know, you mentioned to me prior when we were talking about this, you referred to yourselves, that you said we were dirtbags. We really did,
Yeah.
you know, torment your community. But today, you actually, and I can even speak to this as a personal experience, when my family went through the campfire, she was the first person she came to the station and drop off clothes for them after their home burned down. And I think that really speaks to the kind of people that you are today. And I've seen much of that since then, which is why I invited you to be on the show, because your story is incredible, and that of your husband as well, if you want to share anything about him.
Yeah, my husband, so me and my husband together, we went on this journey together. We were partners in crime, and we got arrested together, and we got clean together. So our clean date is the same. So it was challenging for him, but he now works for the fire department. And, you know, it was a step. Like, you know, he just was truthful. Like, this is who I am. This is what I went through. I mean, he didn't hide anything. He just put it out on the table. Like, and they seen something in him too, just like somebody seen something in me and gave me another chance, you know. And yeah, he's an active member with the fire department, and he loves it. He literally loves it.
He too came out after the fire and helped my family rebuild a home. So kudos to you both for turning your lives around. I'm sure people are talking about this on social. Lisa, what are they saying?
Yeah, people are just proud of you. And also one question, going back to the facility you were in, what are some of the steps they took, that specific facility, to help you get better?
That's a great question.
As far as the facility itself to help you get better, they're not gonna go out of their, you know what? I take that back. There's classes in there that you can take. I mean, it's what you take it for what it's worth. Some people go do it, just to have something to do in there. I literally did everything I could while I was in there. It didn't matter what class it was, I was in it. I was in it because I felt like anything was better than what I was doing. And if I could take one thing out of it, I did. One of the really awesome things that I have to say that I attended while I was in the jail was College of the Redwoods presented classes inside the facility. And so not only were you able to feel of worth that you were actually doing something with your life, but you really were actually doing something with your life, you know? And the guy that brought the classes in, he was awesome. He just talked to you like you weren't an inmate. You were a regular person trying to better yourself. So as far as the jail itself, they're not going to go out of their way to make you do anything, but they will provide certain steps if you want to take those steps. I want to go back a little bit, because there was all kinds of drugs in that jail. All kinds of them. And it just, I knew that if I were to use in jail, what makes me think that I'm gonna use in jail and then get out on the street and not use? And so even though they were all around me, it's just, you just have to make sure that, I mean, you just have to want it. You have to want it in your mind and in your heart. If you don't want it for yourself, you're not gonna do it.
Yeah, very powerful story. Thank you for sharing it with us. And you know, I'm going to go back to you, Dr. Willis. When you get someone in your office that, say, has a severe addiction, say they come into you and they're addicted to pills, or how do you treat them? You do a lot of alternative treatments, right?
Well, yes, I think, again, now the majority of people that come to see me are coming to see me because they have a chronic pain issue. And one of the things that I think is important is that one of the pathways to get to addiction and street drugs, etc., is through prescribed medications. And so that is one way people get there. I think the important thing is, when I'm seeing patients, I'm hopefully not seeing them at the point where they're an addict, if you will. They may be physically dependent, for sure, on their medications. But I'm looking to see whether there's something else that can be done. If about 90% of what I see is back or neck pain. And if you can find a actual remediable problem by doing the appropriate diagnostic scans, etc., there's some things that I can do from the interventional perspective, and there's things that can be done from the surgical perspective, appropriate physical therapy, all of the other things that basically will help the patient get rid of the pain without having to use the medications. Then if there is a physical dependence issue that we need to deal with, we have some other options in terms of medications that we can use, like Suboxone, Butrans, methadone in some cases, so that we can help the patient not go into withdrawal and then gradually withdraw the drugs over a period of time.
We did a story on this. We talked more about this with you, actually, asking about alternative treatments and how people get addicted and how you treat it. Let's take that story with Lisa.
If you've never experienced chronic pain, it might be insensitive to say, I feel your pain.
It's a complex problem.
But if one day you're in pain and go see a doctor,
Most of the time they'd say, hey, take some ibuprofen or maybe some Tylenol, you'll do just fine.
pain management specialist Dr. James Willis says most physicians might give you 2 or 3 days worth of a relatively mild opioid if you need it. But that's where Willis branches off.
I rarely start people on opioid medication. More often than not, I'm in the situation where I'm having to help people get off of them.
Willis says he works to identify the problem and makes a plan. His techniques include
Doing injections, usually with either local anesthetic and cortisone solution, and sometimes doing injections with medication that basically destroys nerves.
He also does radio frequency neurotomy,
which is a procedure that allows us to knock out nerves that go to specific structures in the spine that are pain generators.
and spinal cord stimulation.
We can stimulate the spinal cord and essentially block pain transmission.
But it can be more complex than that. Willis says many patients are already on opioids when they get there.
People have been lured into high-dose opioids over time because, unfortunately, another type of medication or perhaps an intervention would have taken care of the problem, whereas just putting high-dose opioids on it may not make the pain go away, but it makes it more tolerable, or as the patients say, you know, it still hurts, but I don't care.
So I don't care, the numbing effect of prescription pain medications. How do you weigh helping someone when they come into your office, wondering if the end result for them is going to end up in addiction? How do you manage that?
Well, I think you want to probably use the lowest doses possible. The biggest difficulty with any of the opiates is the concept of tolerance. As people use the drugs, they become less and less effective. And so higher doses are required, and people will then escalate their dose. If you have a physician who is continuing to just try and chase that, they're going to wind up on very high doses of opiates. And one of the things that I think is important about it, you know, it's not good for you, but the thing that most people don't realize is that there's something called opiate-induced hyperalgesia, which basically means the medication is making your pain worse. And what happens is, as you increase the dose in some people, you'll get to the point where if you give them more medication, their pain actually gets worse, and then they try and chase that with more and more medication, and they just simply wind up in a vicious circle. And oftentimes, if you can back those doses down, you'll suddenly get to a point where the pain goes away, or not goes away completely, but at least the drugs then become effective again, and it might be a quarter of the dose that you were on before you started reducing it. It's individualized, each person is different, And that's one of the things that with the treatment of pain is there isn't a cookie cutter approach to it either. You have to individualize it.
How do you say no?
You just say no. It's not pleasant to be sitting on the other side of the desk and having someone say, oh, why aren't you going to give me more medication, doctor? And I say, well, I don't think it's good for you. It's not a good road to be going down, and I'm not going to do that. That's what it amounts to. And then, of course, you have the entire range of responses. We have some people who'll kick the table, slam the door, and peel out in the parking lot. And other people who will just simply say, okay, doc, that's, you're the doc, we'll do it your way.
Officer Swanson, I'm going to come to you. The folks that you see on the street that you're working with to help change their lives, how often do you come across folks that maybe started on pills but then went to the street drugs?
I have actually started asking that question, and there are a group of people, that I do come in contact with people that started on the prescription medication, but a lot of them started with marijuana, alcohol in their younger years, and started going down a party scene, and it ended up being, whether it be methamphetamine, heroin, we call it polyusing. A lot of it has started off with just basically the alcohol, marijuana, and being around other people who are doing the same things. The only time I really find someone who has started off with pain medication or pills is they're usually a little bit older, probably in their 40s.
Have you ever had to use Narcan to revive someone in the field?
I have.
Can you tell the viewers if they don't know what Narcan is?
Narcan is basically from what I understand, again, I'm not a medical professional, but it's a blocker that stops the receptors in the brain from the heroin or the opioid, and to where they can come out. They basically can come out of it. I've seen people who have been Narcaned, and within a minute they're back talking. Generally, a lot of times they're very upset that their high is now gone. But
you mentioned that. I think I heard of a case not too long ago where a gentleman, and it was in another state, that he was revived with Narcan, and he was so upset that he, wasn't high anymore, and he ended up shooting a firefighter in that incident. And so there was a lot of feedback from the community there that was like, why are we giving people the tools to go out and do these drugs, but then reviving them when they overdose? And what's the solution to this? I mean, what really is the answer? And this is, I guess, for anyone here on the panel. What can we do in this community to help the people who are suffering with addiction right now?
For me, it's basically trying to connect those people to the services. Let them know that there is another side. You can come through this. A lot of people get down into a very dark hole, and they don't think they can come out of it. And it's basically showing them that yes, you can. Doing it by yourself is it can be done, but it's going to be very hard. So why don't you, let someone help you?
What's some of the horrible things that you've seen out there with folks here in our community that are using drugs? Some of the realities that I think that the general public doesn't get to see.
I've contacted several people through arrests or through going there for to help medical or something like that, seeing some of the abscesses that people have had. There was one individual that started injecting into their neck, and they actually created a hole in their neck from an abscessed injection site. And another big thing that I see, that the hopelessness, that's one of the things that it's actually hard to see, that someone that just this is who I am, this is what I'm going to do, and I can't change it. And seeing hopelessness, especially when that person is 19, 20 years old, that actually really hits me, and I try very hard to try and get them to, to the right resources. Let them know that there are people that care. Let them, know that they have a full life ahead of them. We can get through this.
It's interesting that you said that, because earlier, Rebecca, when I was speaking with you, you mentioned being on the flip side of this when you were suffering, that a law enforcement officer, Sheriff William Hansel, never stopped believing in you, or how did you word that?
He never doubted me.
Never doubted you.
Yeah, he never doubted me. I mean, he knew my name because everybody knew my name. But when I first met him, I just walked up to him and I said, do you know who I am? And I told him my name. He was like, oh, there you are. Like, a face to a name, And so, but he always would, like, inspire me, like, just tell me that he believed that I could do it. And every time because I worked in the kitchen in the jail, and every time he would come in there, he would always talk to me no matter what. And he just told me that I could do it, and he knew I could, and there's a better life, and this and that. And I see him today, and he is always just super proud, and he just never, ever gave up on me, ever. Like, he knew it, and he kept telling me that.
Did that make a difference for you?
It totally made a difference to me to know that somebody above me, that a higher up, knew what I was about in my past and knew that something could be done.
What advice would you give to folks who are where you were back then and they are now?
I would just don't give up. Sometimes it takes people a few times. I didn't get it the first time either. I'm not perfect. I still make mistakes. I just don't make those kind of mistakes. I would say just don't pick up no matter what.
Powerful stuff here, Lisa. Anyone chiming in on social about this topic?
There's a few people online, but one question back to Dr. Willis. Basically, during our interview, you talked a little bit about other medication that you can use to help withdrawal symptoms. Can you talk a little bit more about that?
Well, again, the types of medications we're talking about are things like buprenorphine or Subutex, which is the trade name of that drug. Narcan can also be used, believe it or not, but it is one other way to get people off the drugs. Methadone is a reasonably good drug for it too, and then, of course it was originally used for methadone maintenance for addicts. And the difference between methadone and heroin and some of the other drugs, it's equally addictive. It has the same potential to cause problems, but it's long-lasting, so that you can take a single dose of methadone and stay out of withdrawal until the next day when you get your next dose. Under those circumstances, that's usually done in a very controlled situation in a methadone clinic. Suboxone and also Butrans or buprenorphine are drugs that basically also are relatively long-lasting, but they have a threshold that you reach where increasing the dose does not increase the side effects, so that it's pretty hard to overdose with those drugs. And you can use those drugs basically to help people withdraw from opiates. And then, of course, again, you've got complex things you're trying to deal with. You're trying to deal with behaviors and a variety of other things. Inpatient type drug programs are probably better, because at least in that situation, the patient's in a controlled environment. And hopefully you're going to have some mental health professionals involved, because again, the addiction is not strictly dependence on opiates. It's a very complex behavioral issue, and you need help in many ways to get through that.
Stay tuned for more Addicted Northcoast.
Addicted Northcoast is sponsored by Sutter Coast Hospital in Crescent City.
often is it that you're seeing people who come in for services who are suffering with addiction? How often do they have an underlying mental health issue?
It's pretty common. I'm not sure of the percentage, but often substance use disorders co-occur with post-traumatic stress disorder, bipolar disorder, depression. It's very common. Sometimes people will use substances to medicate some of the psychiatric symptoms that they have from a mental health disorder, or sometimes what I see mostly, because I do work with people who have very serious mental health challenges, sometimes people who have a mental health disorder will use even a small amount of a substance, but because of their brain chemistry and how that reacts, it can be very catastrophic. And I'm sure Officer Swanson can relate to that too, because his population is the same as far as somebody could use the same amount of methamphetamine or heroin and not have the same psychiatric effect as someone who has a co-occurring serious mental health challenge.
What can I do as a citizen in this community to help people who are suffering with this? Because I think we see, and we see it a lot now with social media, is this division of between us and them, and they're the addicts and they're ruining our streets, and them, and we're the great people. But how can we work together to make sure, how can we be more like a missed officer?
A lot of it is like we're just talking about, there's, with a lot of addicts, there's also the underlying mental health cause. Well, there is a huge stigma when it comes to mental health. And when it comes to that part, removing the stigma to, sometimes it's okay not to be okay. If you see, and one of the big things that a lot of the people I talk to is, if you see someone with a broken arm, oh man, I'm sorry, how did that happen? But if you see somebody out on the streets talking to themselves or yelling at the wall, you have a completely different reaction, and it's actually both a medical issue. And so it's having to remove that stigma and trying to help that person that's sitting there yelling at the wall or talking to themselves and things of that nature. It's just removing the stigma on that.
I think you bring up a really good point. There is a huge campaign right now to stop the stigma. In fact, I recently did a post about that because my brother, my little brother, suffers with schizophrenia, and so he went through his own challenges in that respect. And so it definitely opens your eyes when you know someone who has gone through something, who has suffered in that way, to change perspective. As far as addiction goes. But Rebecca, I'm going to come back to you. How many kids do you have?
5.
What would you do if you saw them go down the path that you were taking?
I mean, hopefully I could see it. Hopefully I could see it before it gets way out of hand. I don't know. I mean, I would be devastated, and I would probably show them what my life was. My kids, they know a little bit about, they don't know exactly what I did, but they know that they were in foster care, and they know their foster parents, and which we're really good friends with today. But
that's awesome.
I would just love them and just try to talk them out of it and just show them and just not give up on them.
Are there resources for parents that can, through the county, where they can get help, maybe like through Al-Anon or some, because that's what I see a lot, are family members who really don't know how to react when their child is suffering like this, and what the boundaries should be. So if I'm a parent watching this saying my child is suffering with addiction, what can I do to get help?
Yeah, well, we do have NAMI for support for families for mental illness, and Al-Anon for families, and that's more of a community support group. And then we also have an adolescent treatment program, which is an outpatient substance use disorder counseling program for adolescents under 18, 12 to 18, so that parents could connect them to, some type of treatment. And also through the schools, there's opportunity to have open conversation around substance use and talking with kids. I think education is probably the most important, teaching children, just the dangers of different substances and being really realistic and honest about their effects and what they do and how they're going to react in the brains of young people.
Stay tuned for more Addicted North Coast. We'll be right back.
Addicted Northcoast is sponsored by Sutter Coast Hospital in Crescent City.
Are there any last tidbits of information that maybe I didn't touch on that you'd like to send to the community or let the community know, maybe about your practice, your work, or your life?
Yeah, I have one thing to bring up, and that is that what's happening now is we're having very potent opiates being imported into the country. Fentanyl is about 1,000 times more potent per milligram than morphine. But now we're seeing that coming in from China. We also have sufentanil, carfentanil, and a whole series of other semi-synthetic opiates that are many, many times more potent than fentanyl. And so what that is causing is, people do not have any idea what they're taking when they get counterfeit opiate pills, and it's causing a great deal of deaths. And that's probably the biggest issue right now in terms of the opiate epidemic, if you will.
We're starting to hear a lot more about that carfentanil. That's been a new word to me in the last several months here, so I'm seeing more of that come out. Very frightening.
The interesting thing is I did OR anesthesia for about 15 or 20 years, and we were using fentanyl and carfentanil and sufentanil in the operating room.
Oh, wow.
And some of those were powerful enough that if you got them on your hands, you would wind up absorbing it and overdosing yourself.
With police officers in Chico recently, there was a mass overdose in a home, and the officers that went in to remove those patients were exposed via air to fentanyl and had to be treated. Very, very scary. Does that ever frighten you when you're out in these communities and doing this kind of work?
It's definitely, that's actually one of the big reasons why we started carrying the Eureka Police Department started carrying Narcan is, so we call it self-aid or buddy aid, because if we do come into that, and again, it's also for, helping the people that are in the community, but it's always on the back of your mind when you go into a location of what am I going to run into.
Yeah, well, thank you for the work that you do, all of you. Is there a message that you'd like the community to know, or resources for them to know about before we go?
Well, just that having a substance use disorder is something that's very treatable, and especially now we've got medication-assisted treatments that are between 65 and 75% effective. There's new Medi-Cal benefits that are going to open up larger opportunity for treatment, residential and intensive outpatient and outpatient. But mostly, I did want to mention that the Open Door health care system has a fantastic Suboxone program. So if somebody is suffering from an opioid use disorder and doesn't want to do that opiate anymore, then they can go to Open Door or even often their primary care and ask for a program like medication-assisted treatment that is highly effective, and they can start doing that, yeah.
That's phenomenal that you mentioned that, because I know access to care here on the North Coast sometimes is difficult. I know it was for me when I relocated here to find a primary care physician. It took me 2 years before I finally got into one. But how, if I'm living on the street and I'm suffering this, chances are I don't have my ducks in a row, per se. Mm-hmm. If I just walk in and I don't have a primary care, or I don't have insurance and I don't have any money, will I still be helped?
Yes. Yeah,
That's phenomenal.
and you know, the insurance piece now, insurance does cover medication-assisted treatment. It didn't used to, and insurance is recognizing, you know, like the Addiction Society. Or the American Society of Addiction Medicine, that it is a chronic disease that's treatable, and so we have treatments that are accessible and are covered. So someone would just have to get Medi-Cal, and but the providers would help them sign up for all that.
It's fantastic. And in Del Norte, where do they go? Do you know?
I think they have a free clinic there that basically does Suboxone.
Nice.
And there's mental health professionals available as well.
Fantastic.
And
We're going to get
probably at some point be doing that also at Sutter Coast Hospital.
But I want to end with you, Rebecca, just because your story is so phenomenal and so inspiring. And I get mail from the jail and the prison in Del Norte from folks that are there. So chances are they'll be watching this and seeing this when it airs on television. If you could look into the camera and give them a message as if you're talking to them, if you're taking, you know, a meeting or into the jail or the prison, and you could give them a message, what is it that you would tell them? And can we take her directly, please?
I would just say, you know, no matter what, like, somebody's going through, no matter what you're going through, no matter what kind of addiction it is, if you need help, ask for it, because everybody needs some kind of help. Whether it be somebody to talk to, or, I mean, I don't know what your situation is, but just reach out and ask for it, and don't give up, because it's not the end of the road. There's a way better life out there. I don't know. You're worth something. Don't give up.
Don't give up. Treatment is available, and it can save lives. Thank you all for making the time and making the trip here from Del Norte County. Thank you for the work that you do in our communities, and thank you for sharing your personal story. We're certainly so grateful for that. Thank you at home for watching, and for everyone who chimed in on Facebook and social media. We're going to keep this discussion going. This is going to air a couple of times on television, and we'll continue the discussion online on our Facebook page, Northcoast News TV. This is not over. We are working with Dr. Willis. We're going to be doing several follow-up stories 2 times a month to share these issues with you. So if you want to continue the discussion with us, reach out to us at news@KAFTV.com and let us know what you'd like to talk about, and we're happy to send a reporter your way and continue the discussion on Addicted North Coast. Thank you for watching. We appreciate it. Have a good day.